Hi, I'm Lynn Chapman. I'm the Marketing Director for the Foot and Ankle Center of Lake City. Welcome to our webinar, Should I Get Laser Treatment for My Fungal Toenails? We decided to offer this webinar because so many people with fungal toenails have tried and failed to get rid of their fungal toenails. And we wanted to give folks the opportunity to hear from our doctor about what works and what doesn't, and learn about the laser and how it works as part of a comprehensive treatment program. First, I want to introduce our doctor. Dr. Ryan Berg has been practicing podiatry for over 35 years in the North End of Seattle. He followed in the footsteps of his father, who also was a practicing podiatrist. He received his master's degree in physical therapy from Stanford University and his doctorate from the California College of Podiatric Medicine. Warts certified in foot surgery and is a member of the American Podiatric Medical Association. He has hospital privileges at UW Medicine and was the chief podiatrist at their wound care center for over 15 years. Dr. Berg is going to speak for about 10 minutes, and during that time, if you have any questions, please post them in the chat box. We'll have about 20 to 30 minutes total, and we'll answer all your questions. We'll be recording this webinar, and we'll be sending this to you at the conclusion of this training. So without further ado, Dr. Berg, take it away.
Well, thank you, Lynn. The first thing to talk about is what you might learn during this webinar. I think a couple of things are important. One is how to tell whether to treat the toenails. Two is what works in general and what doesn't. And then, of course, the favorite question of everybody is, will laser therapy work for me? And finally, what is a comprehensive treatment program and why does it matter? So first, I think we need to be able to tell whether or not the nails should be treated in the first place. And that's done by establishing the diagnosis of fungus. When people come into the office with thickened toenails, everybody thinks they have fungus. It is true that the most common cause of thickened toenails and discoloration of the toenails is fungus. But there are other conditions such as psoriasis or eczema that can have changes in the nails that mimic fungus. And maybe one of the most common things is trauma. In exploring patients' history, it's not uncommon that they've been participating in sports or used to participate in sports, and the nails thickened after these periods of time in which they were very active in traumatizing their feet, particularly the toes, during their activities. Once we have an established diagnosis, and that may take some testing, the next question and thing to explore is what works and what doesn't. Historically, treatments for fungus were focused around topical medications. And these have been used for many, many years, of many different kinds. Some of them thin the nails, and some of them do treat fungus. The problem is that topical medications, at least traditionally, have a fairly low success rate in treating the nails, and they have to be treated a very long time in order to achieve whatever effect you're going to get from topical medication. More recent developments have improved that somewhat. Topical medications as a whole are approximately 20 to 40% successful. Again, it's dependent upon degree of involvement of the nail and length of time that it's treated. Next in line that was developed in the 1960s were oral medications. Unfortunately, some of the more successful medications had very serious side effects on the liver. Later, the oral medication became much safer, and their success rate of oral medications can reach up to 74%. But not everybody is a candidate for systemic medications, either because of other medical conditions they have or because of personal desire to avoid systemic medications when treating fungus of the toenails. Finally, laser therapy was introduced. Laser therapy has been around for many years. In approximately 2010, a pulsed laser was developed, and by utilizing a pulsed laser, we were able to apply laser therapy longer without discomfort for the patient of any significant amount, and thus achieve greater success in resolving fungus of the toenails. Finally, combinations of all the above have been used. And the question about what would work and what doesn't and what's best for me center around the things we've just established. And that is how long you've had the fungus and how much involvement in the nails is present. So when we try to answer the question, will laser treatment work for you? We evaluate, determine how much of the nail is involved. The less the nails are involved, the better results. So in general, it is true in our younger patients with less involvement, we can achieve greater success. But that said, we have to establish how important it is for you to get rid of fungus. Because when you ask the question, will it work? You have to decide how involved you want to get in treating this. I'm not here to judge how important it is to get rid of fungus in the toenails. Some people, it's cosmetic, and other people, the answer is they don't want it spreading to other family members. So whatever the reasons are, if you really want to get rid of fungus in the toenail, then you have to understand that it's probably one of the most difficult things I've treated in 40 years, and it takes a commitment on my part and your part in order to achieve success. So what is a comprehensive program? How can we make this successful for you? Well, a comprehensive program includes all of the above therapies combined together. And what has been established is that the skin has fungus in it probably long before the nail does, and it feeds the toenail. So treating the skin with topical medications, treating the toenail with topical medications, laser therapy, and oral therapy, as well as shoe therapy, combined together creates a comprehensive program for treating your toenails. Why treat the shoes? Well, there's one difference between your fingernails that usually don't have fungus and your toenails, and that is you don't wear shoes on your hands. So treating the shoes is important. And ultraviolet light has been established as a very effective means of helping us diminish the chance of fungus continuing to invade the toenails. The comprehensive program involves use of 3 laser treatments, and they can be spaced out between weekly to monthly depending upon the type of involvement of the nails. And then use of the topical medications throughout that time, as well as a short course of oral medication. The judgment about whether or not it's successful. So success can be up to 70% with oral medications. Laser by itself is 60%, but combining all the therapies together can help us increase the chance of resolving fungus of your toenails in the range of 80 to 90%. That said, you have to be patient, and no one is patient when it comes to this, neither you nor I. But toenails only grow 1 millimeter a month. Most resources regarding the discussion about treating fungus toenails will say that you really need to look at the nails somewhere between 4 to 6 months after completing treatment to see how much resolution you've achieved. And with a comprehensive program, it means follow-up. And follow-up may mean further treatment. In summary, fungus is tough to get rid of. That said, it's disfiguring, can be uncomfortable, unsightly, and if you want to get rid of it, it takes a comprehensive program of treatment, utilizing topicals, laser therapy, shoe therapy, and in a lot of cases, at least a short course of oral medication.
Thank you so much, Dr. Berg. Looks like we've got some questions in the chat box. One person wants to know, how many laser treatments will I receive and what will it cost?
Good question. So if we have extensive involvement of nails of both feet, the treatment regimen has included 3 treatments with the laser, and the cost of this is approximately $600. That includes at least the initial course of topical medications and the ultraviolet light that we want you to use for your shoes.
And someone else is asking, will I have to pay the $600 at the first visit?
The program is paid for in advance, and we dispense the topical medications and the ultraviolet light and have the patient use this for a couple of weeks, along with an appropriate nail file. Thinning the nails is also extremely helpful while treating them topically and before beginning laser treatments. Then the patient returns to the clinic and undergoes the 3 laser treatments, currently spaced at weekly intervals, but this varies, again, based upon the involvement of nails.
Someone else is asking, how do I know whether I'm a good candidate for laser? It looks like they're concerned about paying that amount of money up front if they don't even know whether they're a good candidate.
That's a great question. I am very honest about what I think the chances are for success. When we have extremely thickened toenails from the end of the nail back to the cuticle in all the nails, and long history of presence of the fungus, it definitely is much tougher to resolve the problem and can require more than 1 round of treatment. Although I don't promote that, there's no doubt that I'm cautious in recommending laser or any other approaches with that kind of case. Again, when there's lesser nail involvement, maybe only part of the great toenails and some of the other toenails and not complete, then we can have a little more predictability about what one give us in terms of success.
It looks like we have another question. Someone wants to know, how soon can I expect to see results?
Right. Well, again, the nails only grow 1 millimeter a month. And I think early on when we were treating with laser, I think I probably had the patients back too frequently and too soon, because I too wanted the results. And colleagues in dermatology and podiatry consulted with me, helped my patients, because the expectation needs to be that we need to wait. After completing whatever regimen the patient chooses, particularly with laser, we need to give the nails time. The therapies don't eradicate or eliminate the presence of the fungus in what we see right now. So if half the nail was involved, it's not like you're going to treat that and that's going to be disappearing. What happens when it's successful is that while we're keeping that environment of the shoe cleaner and the topicals on the nail after treatment, that the new nail coming out is no longer invaded. And then we see that gradual disappearance as that bad portion of the nail grows out and is trimmed off. That takes at least a few months. So how soon? I would say somewhere in the range of 4 to 6 months.
Well, it looks like we don't have any other questions. I want to thank people so much for attending this webinar, and we'll be sending you the recording by email. And if you'd like to learn more about treatment, give us a call at 206-368-7000. And if you'd like to request an appointment online, just go to our website at www.𝗙𝗢𝗢𝗢.com. That's BERG @dsdpm.com. And I just also want to let you know that our office takes most insurances. If we take your insurance, the first visit will be covered. And so, again, thanks so much for attending. And Dr. Berg, thank you so much for speaking with us today.